Also breaking this morning, kids ages 5 to 11 are getting their first COVID-19 shots after the CDC authorized Pfizer's vaccine for the 28 million kids who are in this age group. Joining us now is the director of the National Institute of Allergy and Infectious Diseases, as well as chief medical advisor on COVID-19 to President Biden, Dr. Antony Fauci. Dr. Fauci, it is great to see you this morning on what is such a big day here. I want to start with what parents need to know. So first, where can parents get their kids vaccinated?
Well, right now, what has happened, and this has really been going on now for a week or so in anticipation of the possibility, which turned out to be the reality, that this would be authorized by the FDA and recommended by the CDC, and it has occurred. And the formulations, which are a different formulation, a different dose and a different formulation, will be now available in pharmacies, in pediatricians' offices, in children's hospitals, and in certain community locations. So that was what the preparedness was about. So it's a good thing. We'll hit the ground running, and probably by the beginning of next week, we'll be at full speed. So parents should consult with their pediatricians, consult with their family physicians, consult with their pharmacists, and they'll be able to know exactly where to get this particular vaccine for their children from 5 to 11.
I was thrilled to find out that at my 5-year-old school, they're actually having a drive for vaccines at the school, which makes it incredibly easy for parents like me. And yes, this was actually scheduled several days ago before this became official.
Right.
There are parents who are hesitant, even people who have gotten the shot themselves. What do you say to them?
Well, it's understandable. I mean, parents are always very concerned about their children. I mean, I have adult daughters, but if my daughters were in the age range of 5 to 11, I would definitely get them vaccinated, but I would, ask the kind of questions that parents should and will ask about the safety, about the efficacy, about why it's important to protect the children. Although children, statistically, when they get infected, they do not get the incidence of severe disease to the level of adults, particularly elderly adults, do. But they're not exempt from getting sick. And we see that in children who can be hospitalized. There have now been about 700 deaths among children, not obviously all within that younger age group, but children are vulnerable. They can get infected, and they also can spread the infection once they do get infected within the family unit. So there's a lot of reasons to get the children vaccinated, and we're very pleased that it's gone through the appropriate process of scrutinization by the FDA, who've authorized it on an EUA, and now the CDC last night with their advisory committee have made the recommendation, which is very good. I'm looking forward to seeing this roll out in a very successful way.
Yeah, and it's a third of the dose. This isn't what adults have gotten being given to their kids, to be very clear. I do want you to address a myth that is kind of pernicious, that this affects fertility. That is something that parents are worried about for their kids. Can you talk about that?
There's no indication whatsoever, or even any mechanistic feasibility that it would affect fertility at all. In fact, in the millions and millions of doses and billions of doses that have been given worldwide of the vaccine, there's no indication whatsoever that it has anything to do with fertility. Giving it to a child, you have to at least look for a plausible mechanism of what that would be, and there is none. There is none.
It's so important to note. You mentioned the hundreds, almost 1,000 children, as you said, of all ages who have died. And I also, though, want to note the other risks to kids, potential long-term risks that we don't know about when it comes to them contracting COVID.
Right.
What do you say to parents about that?
Well, that's just another reason to get the children vaccinated. There is something called long COVID. It is seen in adults and it is seen in children to a lesser percentage, but it is seen in children. And what that is that a person, even a child, can get infected, can get a COVID. It could be mild, it could be moderate, or it could be severe. And when you clear the virus, in essence, you're so-called past the acute stage, often it takes a considerable period of time of getting back to normal. And that's characterized by chronic, almost sometimes debilitating fatigue, muscle aches, sleep disorders, and things like that. So you don't want them to get infected in the first place. And sometimes when they do, they have persistence of symptoms. Yet again, another reason to get the children vaccinated.
And so now that they are starting to get vaccinated, what's the end game here? Is this low-level transmission we're talking about, or does this get to zero spread?
Well, I'm not so sure we're going to get soon to zero spread, but we want to get out of the pandemic phase and into a very good control phase. You know, there are different levels of approach and control of a particular outbreak. You go from pandemic to deceleration, going down, to you go to then control, you go to elimination and eradication. I don't think we're going to get to eradication. We've only eradicated one viral disease, and that's smallpox. But you can get it down to a very low level if you get enough people vaccinated. And a low level is one that doesn't interfere with how we function in society. Because right now, as we all know, this outbreak is having a very profound effect on how society functions throughout the world. We want to get those cases down low enough that it may not eliminate it completely, but it certainly is not going to be a public health issue.
Yeah, that it can really reduce the risk in schools now that kids are back in them. I wonder, with the benefit of hindsight now, looking back on school closures in so many places, do you think that schools were kept closed for too long in some places?
You know, I think it's very difficult to go back in the retrospectoscope and figure that out. There were so many complicating issues going on. Better to look forward right now. I think it's going to make the issue of schools much easier, much safer as we get more and more children. Before, we would surround the children with vaccinated people, like adults, like teachers, like school personnel. Now, if you have the children in addition to the personnel, that diminishes the risk considerably.
Yeah, you know, I do want to press you on this because as a parent of school-age children myself, and with the threat of another potential pandemic, I think that's one of the things we've discussed, that this could happen again. You know, that's an important question. That is about the future, right? What we should do with school closures. Do you think that this could have been handled better and that there would have been a way to keep schools open and mitigate the risk better?
You know, the answer is we have to be humble and modest. We always can do better, always. And that's the reason why you continually look about lessons learned. You know, the idea about getting masks and getting masks worn in school, no doubt masks make a difference. Vaccinations are going to really make a big, big difference. And I think a combination of these things, hopefully sometime in the future, we can not only get the kids back to school, but we can get rid of the masking situation. We've got to do it in a step-by-step fashion. But you're absolutely right. We've always got to examine what we've done and try and see next time, and maybe even as we're living through it now, do better and better. We can't assume that we've done things perfectly, that's for sure.
We saw so many schools do different things. I wonder if you look back on some of the schools that, for instance, they opened sooner, but they took those mitigation efforts, the masks. Maybe they split the class in half so there was a morning and an afternoon so they could distance. I mean, is that something now, as you look back, you say maybe that was a better route?
Possibly, yes. And I think that's the reason why you've always got to look back and see what worked and see what did not work to be prepared for the next time. But again, you know, viruses sometimes act differently. I mean, not every virus is going to be in the situation where it'll have the same impact on school children as other viruses do. So you've got to not only have lessons learned from the past, but make sure you extrapolate that to what you're dealing with in the present. Bottom line, you can always learn more than you know right now.
Yeah, they are our babies, after all. Dr. Anthony Fauci, thank you so much.